Our panelists today are Kathryn Monet, Chief Executive Officer of the National Coalition for Homeless Veterans. We have a special guest with us, Ralph Cooper, who is the Community and Residential Veteran Services Coordinator, Cloudbreak Houston, LLC, and co-founder of National Coalition for Homeless Veterans. The discussion today is going to be the post-COVID veterans experiencing at high-risk homelessness. So it looks like homelessness is becoming more and more of an issue for our veterans. And why don't you lead us into this, Kathryn, and Ralph can give us a little bit of an idea of what's going on out there.
Yeah.
Okay.
Well, first of all, it's really great to be with you all again this month. I think that there are a number of issues facing veterans in the post-COVID world, and, HUD just recently announced the 2020 point-in-time count numbers where veteran homelessness actually increased a tiny bit between 2019 and 2020, and I think there is a lot of worry about, what COVID is going to do to the economic situation of veterans as they move out of, into a post-COVID world, I guess.
Yes. Yeah, and that's really, something that we have to keep paying attention to because a lot of people lost their jobs, in 2020, and we're seeing an increase in homelessness and poverty and, just really poor health outcomes as a result of this. And then this disparately impacting communities, particularly communities of color as well. So we're seeing this happen again and again playing out, and we need to do something about it. So, Ralph, tell us what's going on out there. What can we do to really address this issue?
Well, good evening. I'm sorry, my phone acted up on me.
Oh, okay. Yeah, I was wondering. I heard a little drop.
Yeah.
Yeah.
Well, one of the things that has happened, we have about 500 residents where I work in Houston, Texas, and they're previously homeless, and we are terrified seeing that maybe like 1.4 million veterans are going to be at risk due to this pandemic. And on my site alone, we usually transition folks from the GPD program, which is the transitional program, into the permanent housing structure that we have, which are efficiency units. And then from efficiency units, we encourage our veterans to try to own their own home.
Right.
So as the pandemic has affected every aspect of our economic situation, including housing, including money for loans, it's just a devastating thing. And like Kathryn just said, that the homeless situation is on the uptake now. So we're going to end up with more homeless veterans than we've had in the past few years.
Yeah, and that also goes with their families, right? Because the families are dependent on them as well, right?
Well, if they're homeless, usually they're looking for support from the family. But
yeah,
if we're talking veterans in general, absolutely, especially those veterans who are married with children.
Yeah. So what is the basis of why is it that they're more at risk from the pandemic? Is it because of job losses or placement, or what's the issue? That's really driving their risk level.
Kathryn?
So that's an interesting question, and I'm not sure that I would say that they're more at risk than civilians. I think it's just everyone is at risk right now, right? When you think about what the pandemic's done to, the country, it's been pretty terrible. And I think to some degree, when you think about employment and getting back reemployed, right, there are certain groups of people who don't get reemployed at a higher rate. And the population of veterans that is at risk or currently experiencing homelessness tends to be a little bit on the older side. They tend to have disabilities. Veterans are really attractive opportunities and attractive hires, in my opinion, right? But I'm not every employer in America. And so I think there are just some barriers that exist that you can't overcome age or disability,
Right.
I mean, you can get training, you can do a lot of different things, but I think there are just some challenges that exist.
Yes, yeah. I can imagine that's very true. With the veterans, the health care also is an issue, right? Because before we had some, issues about access and, our homeless veterans actually getting medical care. I can only imagine this makes it worse. So those people who have, high blood pressure and heart attacks, I'm actually working with the pandemic response group, helping the state of Illinois out. I used to be a former director. I was a former director of the Illinois Department of Public Health, so I'm helping out now. And one of the things that I've been looking at, a lot of the data, is that we've been having, an increase in the number of people who are, don't seek medical care, who subsequently die from heart attacks or have massive strokes and those sorts of things. And it has nothing to do with the actual SARS-CoV-2 virus that causes COVID-19. It's that they are not able to seek medical care in a timely manner. So this has changed the whole dynamic on the ground. Whether people are able to, have access to masks and whether they have access to adequate food and nutrition. But have you seen a change in that, in the basic game plan, about how to approach people who are in the situation of being homeless, who are veterans?
Well, Colonel, while the rate of COVID cases among, patient population is falling, the death rate continues to increase for patients within the Veterans Affairs health system. It rose at least 6%. And over the past several months, at least to over 1,000 fatalities. And, elderly veterans, just like the civilian population, are particularly vulnerable to this virus. And so we're facing that situation. And you say that because of the pandemic, people who are elderly that have other kinds of diseases are pushed out because the COVID patients just have pushed the health system to the brink where there are no more beds. And so the VA has stepped up to the table.
Yes.
The VA now will vaccinate not only the veteran who is eligible for VA care, but any veteran that shows as a veteran and their spouse and caretaker. So you don't even have to be a veteran now to get the vaccine at the VA hospital.
Yeah, I was really impressed with that. I went to a VA site. It was and I was we just had a conversation prior to this show about there is a plan now with a commission to look into closing VA systems and whether that is going to be advisable. It came up under the Trump administration, and it's a commission of 9 people who are on that. And we need to step away from those kinds of notions or thoughts. It's one of the most efficient systems that I've ever seen. And as a healthcare provider myself, as a physician, I look at that and compare it to some other systems. When I was in public health arena, there were countries that modeled themselves after our Department of Defense and our Medicare system because they looked at the efficiency of it So if you go overseas, you'll see images of what our DOD does and with the VA system, and then also what our health, Medicare system does. So these systems are really streamlined for efficiency, and they get to the point of taking care of people. And our veterans need to go to healthcare facilities where people are familiar with veterans, right?
Absolutely.
Yes. And so they need
you're talking about what, the largest healthcare system in our nation, and you want to just wipe it off the map? It doesn't even make sense.
No. And that means that our tax money is going to go up, right, as we pay the private insurers to cover our veterans, right?
Yeah, well, that's what I think the previous administration may have been supportive of, but I don't agree. I think cost effectiveness is keeping the VA healthcare system because, like you pointed out, people that are familiar with the kinds of wounds, the kinds of issues, the kinds of combat things that you would not get from a regular healthcare system. The VA system is the expert. Yeah. So we would lose out.
Yeah, you bring up a great point because the VA healthcare system is not just a healthcare provider, right? It is a system of benefits that are extended to veterans for social services programs, training, a place where people actually can come together. And veterans feel good when they come together, when they are in the same space and can talk to someone who is with a common kind of idea or theme. And when you walk into a regular, I can feel the difference if I go into a regular healthcare system as a veteran and when I'm at the VA. It's a whole different feeling. And I think that that's something that we owe our veterans. We owe them those programs that the VA offers. I have no idea of what a private health system will do because they may just say,
they're not going to do anything. We've got veterans benefits. Like you said, the regional office at the hospital takes care of your benefits, tells you about it. We have a cemetery system that is the best in the world, that makes a veteran's family feel so proud when they go to a national cemetery and they see the care and the respect and the honor we give these men and women who passed. So there's no comparison.
That's right.
To just the hospital.
Yeah, and that's just one of the things is that we're supposed to be taking care of our veterans, right? Once they have served and come back home, many of them have been, injured in combat or have exposures to things and traumatic brain injuries and PTSD, and we can go on and on, right? With loss of limbs, and when they come back, why is it we can spend billions of dollars on an aircraft carrier, but we can't do that for our veterans? We can find the money when we need to for other things that are just kind of nonsense, right?
Or tax
right.
Relief for wealth.
That's right.
Yes, you're right.
Yeah, so how can people find out more about what they can do to help our homeless veterans? Because unless we bring up the topic, it sort of is a flight of mind kind of thing where people think about it and they feel like they want to do something, but they don't quite know what to do, and then it's out of their mind. But, how can people really become connected with, the service organizations that you support and that you're involved in, and making sure that as veterans, even as veterans, we should be supporting other veterans, right? Because
absolutely,
I'm by the grace of God, I'm living in a home, right? But the veterans that I serve with, many of them, on the battlefield in Iraq or in Kuwait or Afghanistan, they are not they're not so lucky, and we cannot forget that. So, what should we be doing as veterans ourselves, the veterans' family members who are out there, and then the general community?
Go, Kathryn.
So I've got two things that come immediately to mind, and the first one is to do your best to destigmatize seeking help for veterans who are in your network. I think there are so many people out there, veteran and civilian, who don't often think, oh my goodness, I'm going to be struggling on hard times, or I might be homeless, or I might need to access SNAP benefits, or, whatever it is, right? So do your best to destigmatize those things, especially when you're in the company of people who may in fact need them. I think thing two is, something that takes a little bit more effort, right? But it connects to the organizations in your community that are serving veterans. If you go to the NCHV website at www.nchv.org, there's a tab that says Help for Veterans, and you can actually look by state to see who in your community is reaching out and serving veterans. And, every provider has some unique needs, right? One might need socks, other might need a volunteer to come in like paint or to do things like that. But I think the giving of your time and your energy and, support the folks who are out there really supporting veterans.
Oh, fantastic. One other thing, too, you made me think of, another issue is, as people are reaching out to these, and looking at these websites, but right now we have a new administration coming in, right? And as I was mentioned before, President Trump had this, commission that's going through, which I hope is not going to be, supported if their intent is to defund or get rid of the VA system and privatize it. But I'm wondering if, what would you like to see the current administration do that were kind of roadblocks in the past or things that should have been made better?
Well, I definitely would like to see them. I don't know whether this commission can't be turned in another direction, or another commission be formed to enhance the VA healthcare system instead of trying to privatize it. I think that, we enjoy one of the greatest things. When we fought the Civil War, there was a commitment, just like you had mentioned, Colonel, to, those who won the battle. Them and their loved ones. And we owe them this. And you were in early. You were in much later than me, because I'm talking Vietnam, but you guys have people who are exposed to burn pit.
Yeah.
And they're just now trying to get them to get the help that they need.
Yes.
Who in the regular system is even going to be thinking about that and have the kind of expertise and knowledge to be able to help those men and women who are exposed?
That's right.
So,
yes, and it was something that the Vietnam veterans went through, and that's why I actually joined the military, because I was so disgusted with the way Vietnam veterans were being treated that I actually did a rotation in the VA system, VA hospital, and I was disgusted by the way veterans were being treated from the Vietnam era. So I signed up 2 weeks after starting there back in 1984, and stayed. I thought I was going to be there for 3 years. It turned out to be 26. Wow. But the thing that the Vietnam veterans were facing, because you were talking about burn pits, we were talking about Agent Orange back then, right? And now we're just starting to get people, recognizing it. And many of those Vietnam veterans have passed on. God bless their souls and what they've done for us, those heroes. And so they're not going to be, the time defeated the purpose of them being recognized for the benefits they should have received. And
many of them who died from cancer and other kinds of things being exposed to Agent Orange and those other defoliants, their names should be put on the wall because it is a direct result of that exposure that caused their death.
That's right. That's right. And so, many of our homeless veterans are out there battling these things they've been exposed to, or the wounds of war, and not having a place to go. And the only place that they could actually go to is, I can't imagine a veteran who is homeless going to a private hospital or a private clinic to be seen rather than the VA. I mean, that's like night and day. And, I think there's certain things that need to be addressed and listened to. So I'm just hoping that this thing does not move in the direction of the privatization that people are trying to push for. But, with the homeless veterans, what do you see as being the way forward in the post-COVID time period? What should be done for the homeless veterans? Because they're going to be more disparately impacted by COVID-19. So is there something that the VA needs to see, or the government needs to see, that legislators need to be realizing about the dire need for these veterans?
So I've got a couple of things, and Mr. Cooper, I'll let you go next. But I think the first thing is that a lot of the additional assistance that's been provided to organizations who serve these veterans expires at the end of the public health emergency, whenever that is. And so I think what we're seeing is that, some of the changes that these providers are going to have to make are changes that will withstand the duration of when the public health emergency ends, like spacing people out, sanitizing, doing all kinds of different things. And I think to some degree, some of that additional assistance will still be required. So I think that's something that'll need some legislative action very quickly. We still have a lot of shelters that are congregate and provide really great services, but probably need some funding to space people out a little bit better. And VA, to their credit, did issue a capital grant for some of those providers to be able to do that. But I think by their estimates, they've got about 8,000 beds that need to be spaced out, and the amount of funding that they've got is only enough to cover like 1,000 beds, right? So I think some additional assistance and investments in these programs to really space people out is going to be needed. But, I mean, ultimately at the end of the day, right, I think one of the things that the pandemic has driven home for a lot of us is that housing really matters, right? When you've got to stay safe and shelter at home and you don't have housing, like, you're just out of luck. And that should never be the case for veterans or for anyone in this country. And so I think some additional really bold investments in affordable housing for veterans, quite frankly, and civilians is required in order to move the country forward.
Yeah, that makes a lot of all the sense in the world. And
so low income housing tax credit. You must get your Congress people to absolutely support and keep that in, because that's so critical. You can't hardly build affordable housing without it. And the other thing is that you read the thing, the news, you hear it all the time, that they've extended relief for people who are renting, but the landlord, is still going to want their money. It's just,
right.
It's not, they don't have to pay rent. Eventually they're going to have to pay rent. So what happens? They can't, and they're going to be in the home.
Yes.
People are losing their home right and left.
Yeah.
So we need to build. I think that the administration has gone forward with this, and I hope it passes. This big relief bill is going to do a lot to support it. We need to any people who have influence with the senators that are saying maybe they don't want to support it, call them up and tell them, support this. We need this so much.
Excellent, excellent. We've run out of time, but we'd have to have you back again because this is so critical. We have to follow this issue because it's not going anywhere. We need to be on top of it. So I want to thank the National Coalition of Homeless Veterans. Kathryn, Monet, you're doing a phenomenal job. Ralph Cooper, God bless you for all you're doing for veterans, and just so happy that you're able to do this. And www.nchb.org, go there, check it out, and do what Kathryn said. Make sure you participate in this process. Call your legislators and tell them that they need their stimulus money and this check to go to veterans to make sure that they have that relief bill really addresses their needs. Okay, stay with us, stay with us. We are going to go to the next phase. The America's Heroes Group will be back shortly after this commercial break.